On New Year's Eve 2010, we had planned an early dinner with my mother and our youngest daughter, at age 12, the only one of the children without late night plans of her own. Louisa said she didn't feel well, so we checked and she did have a low-grade fever. 3 days later, her temperature was 106.1 and her blood work was consistent with a blood cancer, likely AML. In 1967, at the age of 5, I had my first research-related blood draw in the office of Dr. Harvey Weiss at Roosevelt Hospital in New York City. My mother found him through our New Jersey pediatrician when she was looking for a reason why we bruised so often and randomly and bled longer than anyone we knew. Our relationship with Dr. Weiss lasted for decades. He always provided us with the latest papers he'd published, pointing out the relevant information and printed pedigrees representing our family. We saw him 4 or so times a year and learned to enjoy an afternoon of museums, restaurants, and Broadway shows at easy-to-digest 1970s prices after a morning blood draw. Dr. Weiss called it thrombocytopenia A because our platelets were low and the ones we had didn't function well. I learned to explain that to my doctor since it wasn't something that was part of standard medical teaching. We would go on to ask Dr. Weiss about AML since both my grandfather and great-grandfather died of it at the age of 72, but there wasn't any genome sequencing or other testing at that time that could specifically identify a relationship between the two. My wife and I had been living in Seattle since 1990 and hadn't been to see Dr. Weiss since then. But I got a call from him one day asking if it was okay for him to give our names to a doctor at the University of Washington Medical Center, a research geneticist, Dr. Marshall Horvitz, who was looking at a connection between bleeding like ours and AML. We said yes, and Dr. Horvitz took cheek swabs from my entire family and told us about the RUNX1 mutation. About a year after Dr. Horvitz and his team published their research, my 19-year-old cousin was diagnosed with AML and was transplanted at the Fred Hutch Cancer Center and UW Medical Center because his East Coast Cancer Center did not want to transplant him while he still had some active AML in his marrow. The research in Seattle's had experience with things like this and were comfortable with the transplant. My cousin is now a married father and thriving. My daughter's treatment also went well. She is now 22 and a recent college graduate. She had secondary thyroid cancer in her junior year and finds it ironic that her scar from that easy cancer is much more noticeable than the pencil point scar from her Hickman catheter. 2 years after Louisa's diagnosis, we are still trying to sort out how to track her older sisters so we could catch any cancer early. Our oncologists at Children's settled on having at least a baseline bone marrow for both of them. One looked fairly normal, but the other, while not showing any cancer, definitely wasn't normal. Since we didn't know what non-cancerous RUNX1 mutated bone marrow looked like, we decided to add me to the baseline study. Through a referral from Dr. Horvitz, I had been to see Dr. Paul Liu and his team from the National Institutes of Health a few months earlier for their research. At that point, we hadn't done a bone marrow aspiration, but my platelet count had been lower than normal for me, although well in the range that they had seen with other RUNX1 patients. My baseline marrow showed that I had already developed MDS in about 20% of the marrow. We didn't know how long I'd had it or how quickly it was progressing, but it was a mutation that would have been difficult to cure if it had developed into full AML. After 2 non-myeloablative transplants, I don't have AML anymore, and I was fully engrafted. I was eventually introduced to Tim Babich, who had been talking with Dr. Horvitz and Dr. Siobhan Keel, my oncologist, and he was funding research through his RUNX1 FPD Foundation. Meeting him was the first time in my lifetime seeing someone with a RUNX1 mutation who wasn't directly related to me. I had many questions. We found out that specific abnormalities we had attributed to the mutation, like hyperflexible connective tissue and mitral valve insufficiencies, were not present in other families. The foundation established by the Babich family continues to fund RUNX1 research projects worldwide. Their funded research may lead us to learn about new types of treatment opportunities or potentials for gene therapies that might be less harsh than standard marrow or stem cell transplants. It also created a platform for education and support within the RUNX1 community, now that we know that there is one. For me, this has been a 53-year journey. Of all the things I inherited from my mother, an interest in and willingness to participate in research has so far proved stronger than any disease.